Hello, my name's Honey Smith. I'm a GP in East Sheffield, and today I'm going to talk about a project that we're doing in Sheffield, delivering the Green Impact for Health Toolkit to practices via a student-selected component. This talk was originally given for the Greener Practice South Yorkshire group, but unfortunately due to a technical error it wasn't recorded, so I'm re-recording it today. So the supervisors for the student selected project are myself and Dr. Helen Toohig, who's another GP in Sheffield. And I'm going to start by telling you a little bit about what the Green Impact for Health Toolkit is. So the Green Impact for Health Toolkit is a tool. The Green Impact Toolkit was originally created by the National Union of Students, and then it was adapted for use by the Royal College of GPs. And it's now hosted with the Royal College of GPs, although they no longer fund it. So the idea of it is to give GPs an opportunity to tick off easy actions to make their practice greener. So I'm just going to show you a little bit about it. So this is what the front screen looks like. And as you can see, there's a whole load of tabs down the side of different actions you can take. So in the clinical realm, there are actions around prescribing, such as quality improvement projects, asthma. You can do an asthma prescribing audit in that section, or you could perhaps do something on deprescribing. Then there's things around travel and exercise, which cross over between the clinical and the non-clinical realm, in the sense that partly about things like active travel for staff, but also about encouraging active travel for patients as well, which is obviously better for their health and well-being, as well as better for the planet. And there's a whole load of different actions that can be undertaken. So the project spans both clinical and non-clinical, to expose the students to the kind of range of things that can be done, and to support the practices at times of extreme pressure to tick off some of the actions that need to be done if we're to reach our net zero target. So that's what it delivers for the practices. But the barriers to engagement with the Green Impact for Health Toolkit, well, they're partly around awareness. People aren't completely thinking of the climate crisis as a clinical issue. Most people now realise it is a health crisis, but the evidence that we've collected suggests that a lot of people still aren't seeing it as a clinical issue. And so they may not engage with it because they may not think of the role that GPs have in the whole realm of decarbonising. And that's despite the fact that around 4 to 5% of the carbon footprint of the country comes from the NHS, and of that 25% of that amount that's contributed by the NHS, 25% comes from primary care. So there may be not enough knowledge and understanding both about the climate crisis as a health crisis and a clinical issue, but also about understanding what can be done to combat that. I think the most important thing is lacking the headspace to actually think about it. GPs are absolutely overwhelmed after the pandemic. There is no headspace to be thinking about quality improvement or how we might run things differently. And that's become even more of a barrier than it was before the pandemic. It was already a problem because general practice is hugely underfunded, but it's become even more of a problem since the pandemic. So associated with that is the time to make any changes. There's also possibly something about the structure of the toolkit, which is not quite as easy as it might be to navigate at times, and that's something that we might be able to look at. There might also be considerations that perhaps it will cost the practices money, although in fact many of the actions, such as reducing energy expenditure or reducing prescribing, might directly or indirectly save the practice money, and particularly if they're meeting, for example, asthma targets under QOF and the new investment fund, they may well actually save money for the practice. So on the other side of things, what does good medical sustainability education look like? And this is something that's very much a work in progress. There is a piece of work underway on a yearly basis now, excuse me, called the Planetary Health Report Card, which gives league tables of how the medical schools are doing on medical school sustainability education, and Sheffield comes in right in the middle with a C. So there's work still to be done. But good medical school sustainability education is really about, and this is true for all practitioners really, it's a lens through which we can see all healthcare, because the climate and ecological crisis really trumps all other wider determinants of health. So if we see everything through a sustainability lens, we're more likely to get it right in terms of sustainability and environmental awareness. So because it's the greatest threat facing our health, it's not, sustainability and climate awareness is not an add-on. It should be core business. It needs to be absolutely central to our thinking. And therefore, it needs to be laced through every aspect of the curriculum so that that's brought into our thinking at every level. We might need a small amount of didactic teaching to give the scientific evidence around the climate crisis and the climate crisis as a health crisis and the kind of areas that people might take action in. But actually, it needs to be thought of in every element of our education. So, for example, if we're talking about heart disease, we need to be mentioning air pollution as an issue. If we're talking about dementia, we need to be mentioning air pollution. If we're talking about falls, we might need to think about how we reduce the risk of falls by deprescribing, and that sustainability issue that comes through the whole of that process, because in the process of reducing the patient's morbidity, which is a good thing for patients, we also reduce the carbon footprint of care. So the sustainability learning objectives need to be laced into all other learning opportunities. And we also need to take an opportunistic approach to applying sustainability lens in all our thinking. So that's when students are on the wards, the people around them need to be thinking about sustainability as an issue, and that's the same in general practice. So I just want to cover briefly the principles of sustainable healthcare and quality improvement. So this comes from the work of the Centre for Sustainable Healthcare, led by Dr. Frances Mortimer, and they came up with 4 pillars, if you like, of sustainable healthcare. The first of those is disease prevention and health promotion. The second is around patient empowerment and education. The third is lean pathways, how we can stop doing things repeatedly or inefficiently in the health service. And the fourth pillar is low carbon alternatives. And that's the bottom one, because the other 3 are about good healthcare. They're about excellence in healthcare. We should be doing these things anyway, to save the resources of the health service, and even more importantly, to improve patient care. But low carbon alternatives is the lowest on that grid, but also very important. So can we use reusable masks instead of throwing them away? Can we use reusable instruments instead of throwing them away? Can we, is it where it's safe to do so, swap from metered dose inhalers, for example, to dry powder inhalers? So that's another strand of sustainability that we need to consider. So the answer, this project really arose out of how can we deliver sustainability, how can we deliver the needs of GPs to deliver sustainable education and educate medical students about the climate crisis as a health crisis at the same time? And that's what this project came out of. So it's a 6-week student selected component for 4th year medical students. The students have access to the Greener Practice website as an educational and practical resource. And any of you who are familiar with the Greener Practice website will know that there have always been a lot of recorded events on there that people can rewatch and learn about the climate crisis as a health crisis and what we can do about it. We recruited GPs in South Yorkshire, and actually one in Derbyshire as well, and offered them student input to complete the Green Impact for Health Toolkit actions. So these were GPs who already kind of activated to realise it was something they needed to do, but very often were struggling to find the time or the headspace to do it. And they were really keen to support a student with actually quite minimal input from the practices, really, to tick off some of those actions. In the first year, we got a small pot of funding from South Yorkshire Climate Alliance, and we now get some funding from South Yorkshire Integrated Care System. So the resources for the project. So the students have been gradually putting together a Google document which I'll show you in a moment, which brings together all the resources that they need, and they add to that on an iterative basis. They also have access to the Greener Practice website, as I said, which gives them lots of tools to build talks that they want to do, you know, presentations to the practices, audits. You know, they can reproduce a lot of those things without extra effort. So I'm just going to pause there and just then share the document. Okay. So I'm hoping you can now see the Google document that the students have created. If not, I'm going to be whittering on without you being able to see this for a little while, so apologies for that. But so basically, the students put on some useful websites that basically help them to complete some of the actions. So, for example, Matt Sawyer's very excellent resource, SEE Sustainability. And obviously they do access the Greener Practice website as well. Then there's a list of the previous practices that have been involved with the project, and each of these documents has a list of things that the practices have done and where they've got to in terms of their award status, because the Green Impact for Health toolkit gives bronze, silver and gold and carbon awards according to how many actions have been ticked off. So these documents record how many actions the practices have done and whether they've achieved any of those awards. And it also gives an action plan for the next set of students taking over so that they can pick the pace up quite quickly when they come to the project. There are a list of presentations for the practices. So the students, for example, in my practice have done a presentation on diet and the environment. They've done a presentation on declaring a climate emergency. They've done a presentation on fuel poverty. So there's lots of different things that they can do, and each student can improve or adapt the presentations as they wish so that it's authentic and coming from them. There are a lot of posters for the practices, so all sorts of things like buying fair trade, saving water, flushing the toilets on a single flush, air pollution, fuel poverty resources that can be sent out to patients on Accurix, and information about air pollution that can also be sent out on Accurix, instructions as to how to change to double-sided photocopying. So all sorts of different actions that can be done. And there's quite a lot of stuff on inhalers because that's an obvious focus. And then the students do a handover document for the next set of students so that the next set of students know exactly how to get started, how to log practices on to the toolkit, and how to make progress quickly. And then there's a series of audits as well that the practices that the students can do and reproduce quickly for the practices so that they don't have to trouble the practices too much. So I'm going to come out of that document now. So what do we ask of the students? We ask them to be available to work on all aspects of the toolkit, and of course they are available. They have a fairly free timetable. Actually, it's not a very structured timetable, but they organise themselves and need to be quite focused and resourceful. So we ask them to prioritise the work that the practices want doing. Now, for some practices, they will be really clear about what they want to achieve. Other practices just say, just do what you can. We don't mind what you do, as long as you tick off some action for us. And so the students need to be flexible around that. They might need to guide the practices on what can easily be replicated. So, for example, they might say, well, we've got an audit we can easily run off for you. Would you like us to do that for you? Or we've got a presentation on air quality, or we've got a resource that we can send out to patients about fuel poverty and how they might access help for that. So the students can actually be quite proactive in guiding the practices. They need to work fairly independently and use their initiative. And they need to update and improve resources so that future students can pick up the pace, as I say, quite quickly on the next project. And they need to feedback. We asked them to feedback any ideas for improvement, and they've been brilliant at that. They've been really useful to improve the project on an iterative basis. So the range of activities that they can do, as I say, is educational presentations to practices, creating engagement with the practice team with a kind of motivational interviewing style. And we're going to work up something around maybe training the students to do that better, and because it's a really useful skill for them to have for the future. Clinical audits and quality improvement work on asthma, deprescribing, disease prevention and other things. Creating patient-facing information to improve health and well-being, and being able to use Accurix to get that out to patients has proved invaluable. Non-clinical audits such as energy use and travel audits is a really useful way to engage the team. And information for practices such as posters, changing the energy supplier, information on environmentally aware purchasing and so on. So what do we ask for the practices? We ask them to arrange an initial meeting with the students as early in the placement as possible. And that can be difficult because obviously the students aren't focused on the project until they arrive, until really the week before they arrive. But ideally the practices need a little bit more warning about that. So we're trying to iron out that little glitch at the moment. If possible, it's helpful if the practices can think about the areas that they want students to work on, because then the students can really get cracking on things really quickly. They need really ideally to make time available in meetings for students to do educational presentations. And one suggestion that came out of this meeting was that maybe a 5-minute slot in each meeting might be a really useful way to keep the matter on the agenda for the whole of the 6-week placement, and hopefully embed some thinking around sustainability for the team. And the students would learn to give small nuggets of what the practice could do or what education they needed in little tiny bites. The practices need to give the login details for the Green Impact for Health Toolkit if they're already set up for it. Now, we're trying to keep those details if the practice allows us to, so that students don't have to keep asking. But if the practices haven't given us the details, they need to give those details to the student when they arrive. The students need access to a computer if they want them to do things like clinical audits. Or to change the settings on the computer to make sure that they're printing double-sided, for example. The students need to have a contact person who can get they can go directly to if the students if the students get stuck. And the thing I'd say about it for the practices is the more you put in to this project, the more you will get out. But it's not essential. If you really can't give the time at the moment, we do understand those constraints, then at least you're getting the students to do something for you, and you have the sense that you've achieved something as a practice that you can then take forward and become more empowered to make changes in the future. So about a year into the project, we did an initial evaluation of it, which was in May 21, and that, as I say, was after the first year. The numbers of students at that time were small, and the number of practices was small as well. We'd had 5 students on the project and just 4 practices at that point, but we felt it was important to see what was going well and what we could do better, particularly in terms of picking up the numbers. So it gave a flavour of the possible benefits and an indication of how to improve it, and it acted as an opportunity to improve on the project in an iterative fashion. So part of the evaluation, this was done by a student on an elective called Kate Ledyard, and her supervision was undertaken very kindly by Helen, who's now supervising the project overall with me, and Kate Turner, who are both extremely helpful in getting this evaluation done. So as you can see, in terms of the awareness of the climate impacts on health, the students' understanding of it improved quite significantly, albeit the numbers were very small. But for 3 of the students, their understanding improved during the project. 2 of the students came to us very highly aware, and that's why they chose to do the project. But certainly it did have an overall good effect on students' understanding. And in terms of the effect on clinical practice, all the students understood better at the end of the project that this was an important issue in clinical practice. And that's quite major, because this was one of the things that is difficult to get across to experienced clinicians. So if the students are getting this at the beginning of their career, there's a better chance that they're going to embed this in their clinical practice. So we asked them about how satisfied they were with the level of teaching on the relationship between climate crisis and health and the Sheffield Medical School curriculum. And at the beginning of it, they were moderately happy with, or some of them were moderately happy with what was going on. But after the SSC, I think some of them realised that that perhaps they hadn't understood as much, or at least that there was much more to learn than they'd appreciated. So what did the students learn? They learned about the admin side. They learned about the admin side of general practice, and this came from the initial evaluation. They learned about changes to the buildings that could be made to make the buildings more environmentally friendly. They learned about the criteria that were on the Green Impact for Health Toolkit. They learned how to do an audit, which is great, isn't it? Because then they know how to do it later on. They got a feel for that, and that will set them in good stead for their future 3B placement if they hadn't already done it. They learned about different types of inhalers. They learned about social prescribing, the fact that it existed and the fact that it was important. They learned about the environmental impact of some inhalers. They learned about small changes within the practice itself. And they learned about the environmental impact of prescribing, which is the most significant part of the carbon footprint of general practice. And the things they said about their future practice was that it would help them to reduce and avoid polypharmacy. They learned about that they wanted to think about the environmental impact of prescribing, the importance of social and green prescribing, which is social prescribing in nature. The awareness of the environmental impact of inhalers was something they really wanted to take forward into their future practice, and learning how to do a QI project. So really important learning. So the benefits for the practice that they reported were that they achieved, now they put low priority aims. I think what they really meant by that was aims that were not in their priorities in their immediate practice because the practices were so under pressure. They wanted to do them, but they really couldn't prioritize them against the immediate pressures of seeing patients. They felt that it encouraged positivity and a change in practice where there was guilt about not addressing it. So it really helped to address that guilt they felt. And that's really positive in a workforce that actually can feel quite demoralised at the moment. It started a discussion and introduced some prescribers to green and blue prescribing. So if people weren't aware of that, it helped them to understand that. And this one I really love. It encouraged us as a practice to set up a green team, which was a mix of clinical and non-clinical staff. We've already lobbied our local pharmacists to start recycling inhalers, started some local litter picks, investigated glass milk bottles, had the flushes changed in our toilets, and been on some local walks from the practice. So it really did start to embed in the practice, who obviously were already an activated team, but nevertheless, it moved them on in that conversation. So what came out of the initial evaluation is how could we improve delivery for the practices? So the practices wanted more detail at the start about the Green Impact for Health Toolkit criteria, the awareness of setting up the Green Impact for Health Toolkit with a general password, and prior communication setting up a visit. So we're really working on that. They wanted an initial meeting at the start of the SSC to enable the students to introduce themselves and explain the project and its aims, and link the practice with the Greener Practice website and start to engage the staff. They wanted a suggestion of what had worked well at other practices, so now the students routinely do that. The practices wanted to know dates of the placement in advance, so I started sending out the dates of the placement as soon as I got them from the medical school. They wanted the students to work independently, and they wanted us to direct the students more effectively, and we have got better at doing that as the Google document has developed. They wanted improved scheduling of meetings with the students, so we now try to set those up much earlier in the placement, or before the placement, I should say, because it is only 6 weeks. And they wanted a final meeting with the students to summarise what had been achieved and the progress had been made. And they wanted a written report that they could then put in the practice newsletter. In addition, as I say, from the meeting that we conducted for Greener Practice South Yorkshire, some of the practice wanted little 5-minute chunks of education on a weekly basis. So in terms of how we could improve the delivery for the students wanted more information on the day-to-day work during the project. So we're improving that in terms of putting in the brochure the fact that they need to be quite self-directed, but that they have the Google document as a resource, and they have weekly supervision with me and Helen to make sure that they keep on track, and to support them with any hurdles that they encounter. So they wanted a handover document from previous students. That's now in place. They wanted clear arrangements at the start of the project. As I say, that's going into the original brochure. They wanted timely responses from the practice contacts to set up initial meetings. Now, obviously, that's really difficult because we do appreciate how incredibly busy staff are, and it's difficult for them to think ahead hugely. But it did mean that sometimes the students were 2 or 3 weeks into the placement before they heard from the student, before they heard from the practices. So we're trying now to do that ahead of the placement. As soon as I know that I've got at least one student, I try and put the practices in contact with the student early. So the students wanted improved information, and they wanted more practices being involved, which actually has now happened. So that's really encouraging. So in terms of the numbers, we now have 10 practices actively involved, and another, that's actually now 3 practices starting on this placement. And since this meeting, we've actually heard that Doncaster as a PCN want to take on this project. So that's really exciting. There are another 4 practices that initially expressed an interest in a student, but when I've sent them emails asking them if they'd like a student, they haven't felt able to engage. And I suspect that's due to workload pressures. So we'll keep on sending out emails, and hopefully at some point they might feel able to have a student, because really it isn't dramatically onerous on the practices. It requires a small amount of input. So we're getting about 1 to 4 students per placement. We would take more if more were sent. We're keen to take more students. And we've currently got 1 student who's actually working in Norwich, so supervised by us, but actually working in Norwich. And that's a new departure because the student really wanted to go to a place where his girlfriend was for the placement. And we felt that as long as the work's been done to decarbonise and to become more sustainable, that was fine. We could also consider taking elective students from other areas onto the project to help with the project within Sheffield. So that's another area for development. So during the placement, the practices involved have completed an amazing 257 actions, and that equates to 883 points awarded, because the point system is weighted according to how significant how impactful the action is. So, and that equated to either 1 or 2 bronze awards. We think it was probably 2, but we couldn't get information on one of the practices, and 2 definite silver awards. Now, not all the actions were directly attributable to the students. My practice and one of the other practices involved in the project were very committed to doing a lot of the actions themselves, but a significant number of those actions were completed by the students. And even where they weren't, as I said, the presence of the students created a better engagement that then meant the practice went on to deliver more and more changes. So that's really exciting. So if you're a practice in South Yorkshire and you'd like a student, or if you work in another area but would like to send us a student on an elective basis, that would certainly be a possibility. You can email me at honeysmith63@hotmail.co.uk. I contact all the practices before a placement starts. Practices are wanting a student are prioritised on a first come first served basis. So if you say that you want a student and you're quick to get back to me, you will go to the top of the list. We'd love to start working with some new practices. And as I say, since I first delivered this talk, Doncaster have responded very favourably. So that's really exciting. And as I say, we could consider elective placements in small numbers from other universities. So just some thoughts about how we might further improve the project. We're looking at formal education sessions on engaging teams with change. So I know that there's a similar project that was running in the Bristol region with input from the Centre for Sustainable Healthcare. Now, I think at the moment their scheme isn't running very well because they got a lack of uptake from the students. but one of the things that the Centre for Sustainable Healthcare offered was some training for the students at the beginning of the project. And I think that may well be quite useful for us. I think it might actually help the students to be even better informed at the very start of the project, and certainly to look at how we engage teams with change. So we might record teaching sessions for the students on a variety of topics so that they become very familiar with that from people who are fairly expert in the field. And we'd like to have a larger number of clinically orientated projects for the students to do. Unfortunately, the Green Impact Health Toolkit doesn't incentivise repeated engagement with QI projects, but nevertheless, teams that are keen on sustainability will be keen to involve with a number of different projects. And so we're looking at that, building a resource that we can put together to deliver very easy action quality improvement projects. So during this meeting, we asked the thinking time, how might the scope, reach, including to other areas, and effectiveness of medical student delivery of the Green Impact for Health Toolkit be further improved, both as a learning activity for the students and as a means of delivering carbon reduction and sustainability actions to practices. And out of that came a Google document that I'm going to be going through quite carefully to see where the learning was, and that was a really useful process. So we will be further improving the project on the basis of what was said in that meeting. So during the original meeting, the students also presented, and unfortunately, as I say, due to my technical error, that wasn't recorded, which is a real shame because the students spoke very well about the project. But I thought I might just add in their slides just to tell you a little bit about their perceptions of how the project is now going. So, oh, I don't know if I can make this bigger. No, I don't think I can. So the students very kindly produced a few slides for us, and as I say, spoke very well in the meeting. And I apologise to Anna and Ben who presented that I didn't manage to capture that. But basically what they said was that they achieved a number of different things from clinical to non-clinical actions. So they completed an audit that I designed on anticholinergic burden, because anticholinergic burden is particularly dangerous for patients, as I'm sure you're aware, increasing the risk of an anticholinergic burden score of over 3. So that's drugs that have this anticholinergic burden. If you score over 3 on that with different drugs, you have an increased risk of falls, cognitive decline, and death. So it's an incredibly important area to look at in our deprescribing, and obviously has a massive carbon impact, both in terms directly of the deprescribing, but then indirectly because of the reduction in falls, with all the consequent effects of admissions to hospital, increased input from health services, and so on. And in terms of cognitive decline and all the knock-on effects of that. So it has a massive effect if we can reduce the anticholinergic burden. So they did an audit for a practice on that. They created greener practice sections on the GP's website so that patients would know what they were doing in the environmental realm. They put up posters in the waiting rooms on breastfeeding, inhaler information, period poverty, because obviously if people are using disposable period products, they're neither particularly good for their purse nor good for the planet. And so there are ways of educating people around that. Fuel poverty, they collected data on patient and staff carbon footprints. So the pictures there, the top right one is the students in our little community garden that was just being developed while they were with us. So they came out to help us with that. And that's about the use of the green space in the NHS estate. And that picture below was the garden in its very, very embryo stages. It's now looking much nicer with those pots full of plants. And then obviously there's a picture there of the notice boards. and the websites. They also achieved switching search engines to Ecosia, which donates trees to, which plants trees each time there's a search on it. They made posters about switching from aerosol inhalers to more environmentally dry powder inhalers so that patients were aware of that. They gave a presentation to the practices on the benefits of dry powder inhalers, very much in the context of it being about self-management of asthma and improved asthma care. And they did a poster about that as well. They labelled the bins to make sure that people were putting things in the right bins, because if you put things in too high a level of waste, the carbon cost and the financial cost of disposal and incineration are much higher. They collected data on the energy usage of each practice so that progress could be monitored. So the problems that they faced were that it's not very long placement, it's only 6 weeks, and it did go very fast. So sometimes it was difficult knowing who to contact for certain tasks, and figuring that out took time. They recognised that the GP practices were very busy, so they had to work as independently as possible. But on the other hand, they actually quite enjoyed that, and they felt it was a good experience. So they improved the handover process, and they did a brilliant job, this group, on improving the handover process. They set up a traffic light spreadsheet for each of the practice with tasks, and after each meeting they made a to-do list on a shared document, including the dates of future meetings, so it was always clear what the new actions were to be taken. And because this group were really proactive about that, it meant that the next groups can carry that on. So it helped their learning, because they went from having little awareness of the interconnectedness of the health service with climate change, and they felt empowered to reduce both the NHS's carbon footprint and their own in personal ways. They recognised after the project the importance of anticholinergic burdens and the importance of structured medication reviews, and they learned how to perform and write up audits and QI projects, which is hugely useful. They learned a lot about inhalers and about asthma management, and where possible, initially starting patients on dry powder inhalers where they were suitable. So in other words, making that the default option. So thank you for listening to the talk. I hope that's been useful, and I hope that gives a flavour both to future students and potentially future practices who might want to get involved in this project. It really is an exciting project, and we're looking at lots of different ways to improve it constantly, and to share the learning with other medical schools and other areas. Thank you. Bye-bye.